Hey, I'm Teresa. I'm a dental hygienist. I've been doing this for 40 years. I had a really bad experience as a child in the dental chair. Was not very good at my home care. When I was 16 years old, and instead of my hygienist preaching at me, she actually taught me how to take care of my teeth. Through the years, I have learned tips of the trade. I'm going to teach you how to take care of your teeth and make your dental experiences a much healthier and happier place. Hey, welcome back. I hope you're liking the videos thus far. We're going to have a little teaching tool today to help you out to figure out what restorations are best for you. Restorations can be fillings, crowns, how to get your teeth back to normal. Okay, well, not normal, how to get your teeth back to a healthy state. Okay, there are types of restorations. There are two that used to be very popular was the amalgam filling. It's known as a silver filling. Basically, when you do a silver filling, you have to make the base of the filling. These are your hills. I failed art in school. This is looking on. You have to make the base of your filling wider than the top so it doesn't fall out. So usually more than likely over time you're going to crack a cusp and it will fall off, and it happens almost on a daily basis in our office. The composite fillings are white fillings, and they are basically the most popular. Very few people will do silver fillings. They will do silver fillings down at the gum line because if you get bleeding on the gum, the white filling doesn't clean as well, and the silver filling is a lot more smooth. So you may still get a silver filling down at the gum line if you have those issues. If they can't get a white one, if they get a composite filling down there, it may bleed a little bit, it may not seal, so they may have to go with silver. It just depends on the situation. Composites are great. You don't have to take off as much tooth structure. It helps bond the tooth together to help it from breaking. Do silver fillings last forever? No. Do composite fillings last forever? No. Okay, the next one is an inlay. So you have hills. I'm going to do a molar. So if you're looking down on your tooth, you have hills and valleys. And yes, I am no artist. So when you do an inlay, they take out this middle portion here, they take out the decay, and then they're going to glue a permanent, whether it's porcelain or gold, inside. So it's called an inlay. Gold is the best thing you can put in your mouth. If your enamel heats up and gold heat up, it will expand at the same rate. If you put cold in your mouth, they will contract at the same rate. So they are very compatible. I have seen gold fillings put in during World War II, and the veterans that come in the office still look great today. Do they always last forever? No, because the cement can fail and you can get cavities underneath those areas. So nothing lasts a lifetime. An onlay is the same thing as an inlay. Is they're going to take out whatever the decayed area is, but it may include a cusp or a couple of cusps. So you don't have to do the full crown. You don't have to take off as much tooth structure. So you may have one cusp, two cusps, or three cusps that are involved in it, but there's less anatomy taken off the tooth. So that is called an onlay. A root canal is when they go in and you're going to look in, we're going to take a tooth, there's your hills and your valleys, it looks like a heart, and these are your roots. So you have your pulp, then you have your nerve canals. So what they do is they're going to drill through, they're going to take out the decay, and then they're going to take out all of the pulp, and then they're going to take out all of the nerve channels all the way down to the tip of the root. And then they're going to fill it with a substance so no bacteria can get in there to cause infection. Once you have a root canal done, because the tooth will become brittle because you're taking out the life of the tooth, you do have to have a crown to go on top of the tooth. A crown will cover the entire tooth. They can either be gold, porcelain fused to gold, or ceramic. Now, all the people that have ceramics are done in the office. It's porcelain, they shave it down, they take an impression, or they scan your mouth. They will take a piece of porcelain and they will shave it down, and it'll be glued on that day in the office. I have seen a lot of failure with the ceramic crowns. If you're going to get a tooth colored filling, it is porcelain fused to metal. What you'll see is the porcelain tooth. It'll look just like a tooth, but at the bottom right at the gum line, you'll see a little bit of the metal at the gum line, and I can show you in my mouth what they look like. What that does is it helps with the gum of the tooth. It helps with the health of the tooth, and it's easier to clean down there if it's metal. If there's porcelain, there's a little bit of a lip, and you may not get underneath it enough to clean it because it has to be thick enough that the porcelain doesn't break. So it is better to have a porcelain fused to crown, and it's done in the lab under heat. The gold is the ultimate if you can afford it, because they can take off less tooth structure, and they will last a very, very, very long time. An implant is when they take out a tooth and they're going to put a screw in the bone, and it's got little screws, and then they're going to build an abutment on the top. And so basically what you're going to do is they're going to place the screw. You want the bone to adhere to the screws. On the bottom jaw, it takes about 3 months to heal. On the top jaw, it takes about 3 to 6 months to heal. After the 3 to 6 months, you're going to have everything under the gum, or you'll have a healing cap on it. Then you'll come in and they're going to put an abutment. They're going to screw an abutment in, and then they're going to take an impression for the crown, and the crown's going to fit over that abutment. And the crown can either be glued in or it can be screwed in depending upon the type of your implant. And yes, you can go gold. Most people do the porcelain. The porcelain in the back, you have to take off more tooth structure. So usually when you get to the way back of the teeth, they may make a metal-based biting surface because they have to take off less tooth structure, or there's not enough room back there to do a porcelain fused to gold or porcelain fused to metal crown. A partial denture is when you get to keep a couple of your teeth, and then they're going to place something that comes in, and it's a removable appliance. So it'll come in and come out. You'll take it out every night, and it's going to fill in all the spaces that you don't have teeth, but you still get to have your own teeth, and it's anchored in, and they can be either on the bottom or on the top. And a denture is going to be the full set of teeth on the top that are replaced, or the full set of teeth on the bottom replaced. It's going to go over your gums, and sometimes what they can do is they can take some implants and put them in, and it depends on your mouth and your jaw, but usually they place about 3 or 4 implants. The top dentures work pretty good because you have the roof of your mouth to work with, and you can glue it in with some glue. The bottom is shaped like a horseshoe, and your tongue is going to move it all around. So sometimes they will place implants if there's enough width and enough height of bone. And then sometimes they can either put abutments on the top. You will either have your denture on the top or the bottom, and it will snap in or snap out. And there's little gaskets that they will change out that go around these little abutments. The other thing they can do is they can put a rod. They will put a rod in, and they will screw it into these implants. So there's a much more stable area for your denture to snap in and snap out. And I've seen the rods, or I call them bars, where they can go around all your implants on the bottom, and it has much more retention than sometimes the implants. It just depends upon the force that they can put on those implants and the width and the height of the implant, and that is something that your dentist will go over with you. I hope this clears things up a little bit, so you can make better informed decisions for yourself. If you have any questions, make comments in the comment section. If you like it, floss the like button, and don't forget to brush the subscribe button. Thanks. Have a great day.